Indeed, we are seeking your views via social media platforms, especially on Twitter. As Nancy has told you, our hashtag is Sick Hospital. Keep telling us what you think of what is happening in the public health system. Let me take a look at some of your comments on Twitter. Steve Kimeu says, story of nurses neglecting their work is very disheartening. Delivering while standing unattended is unheard of. That is Steve Kimeu. And another one from Ambassador Olunga on Twitter also said that infant did not die due to shortage of nurses. There were 2 nurses and only 1 expectant mother coming to deliver. So again, just faulting the public healthcare system. Samuel Njora says, negligence is negligence, whether in shortage or abundance. Demotivation and don't care attitude is common. Let me just read one last one here from Caleb Choro, who says, even though negligence is a big issue, even if there are few, they need to address life in a high manner. Keep sending us those tweets. Tell us what you think. Of course, my Twitter handle is Ben_Kitili at Kachungira. That's Nancy's Twitter handle. And of course, at KTN Kenya. Our hashtag is Sick Hospital. Keep telling us what you think about this latest disheartening story from the county of Nyeri. Now, that tragic story from Nyeri is only the latest in a string of cases of medical negligence at public hospitals. Some that were exclusively exposed on KTN could make any pregnant woman shudder at the thought of giving birth in a public hospital. KTN's Mashirima Kapombe looks through our recent files to reveal that growing monster in Kenya's public healthcare system.
This was perhaps the story that we hoped would bring change in Kenya's public hospitals, especially in the way delivering mothers are handled. It was at the Bungoma District Hospital in September last year when a woman forced to give birth on the floor did not warrant any mercy from the nurses. Instead, she was slapped for soiling the floor and not being patient enough to wait for the nurses to get her to the delivery room. A scenario caught on a mobile phone camera by another expectant woman in the hospital who changed her mind about delivering in the hospital after the episode. 2 months earlier, Joanne Akinyi was trying to get justice for the death of her newborn baby, allegedly at the hands of a doctor at a hospital in Nairobi's Umoja Estate. She was in a private hospital, but the extra care she expected to get cost her a great loss.
Kaniambia Johnny, uchungu umesikia, nilikuwa najaribu kuvuta kichwa mtoto lakini kichwa imekwama. Sasa wacha nirudishe ndani haraka haraka nipasue tena sehemu kubwa. Alifinya mtoto akirudisha ndani apasue tumbo.
John says she delivered her baby through a cesarean section, but something must have gone wrong. Back at the Bungoma hospital, this woman was lucky that her baby lived, but she claimed to have had cotton wool left inside her womb after a cesarean section. And then there was this man whose wife died after a cesarean section allegedly conducted by a medical intern at the Thika District Level 5 hospital. He shared his story 5 years after his wife's death, hoping that justice would be served. The latest incident at the Provincial General Hospital in Nyeri may perhaps end up in the archives as just another case that we can pull out at a later date when another case of medical negligence comes up. The tragedy, however, is that Kenyans have nowhere else to run but to the same healthcare givers in the country's public health facilities. Mashirima Kapombe, KTN Prime.